There are now more confirmed cases of the new coronavirus outside China than in the country. And the World Health Organization says the hotbed of new infections has shifted.
Europe has now become the epicenter of the pandemic.
Italy now has the most COVID-19 infections outside China. The country is now under lockdown in an effort to contain the spread of the virus. But infection rates continue to soar. Thousands of new cases have been recorded over the past several days. It's not a wave, it's a tsunami, said one doctor at an intensive care unit in northern Italy, after infections nationwide jumped by nearly 3,600 on March 15th. After Italy, Spain has the second highest number of infections in Europe. It is under a nationwide lockdown for at least 2 weeks. People are barred from leaving their home unless they need food, medicine, or to go to work, if they can't do so remotely. The French president has also ordered people in his country to stay home for 15 days, saying any violators will be punished. And he's asking Parliament to approve a law, giving his cabinet the power to govern by decree in areas needed to manage the COVID-19 crisis. Germany currently has the third highest number of coronavirus infections in Europe. All non-essential shops, bars, religious facilities and sporting venues have been ordered closed, with no time frame on when to reopen. German citizens have also been asked to refrain from traveling abroad because of the risk they may not be able to return. But public health experts are warning about risks faced by other countries and regions as the coronavirus continues to steadily spread around the globe.
Without drastic action, cases could double every 5 or 6 days.
The United Kingdom's approach to curbing the spread of COVID-19 sharply differs from the lockdowns and border closures other European countries have adopted. People are being asked to self-isolate if anyone in their household shows symptoms of the virus, such as a persistent cough or fever, and to refrain from mass gatherings. But schools and businesses remain open, leading to critics saying the government's measures are not strict enough. Medical professionals in Indonesia have expressed concern that COVID-19 cases are either being underreported or going undetected. Other countries in Southeast Asia started reporting infections in February, but at the time, Indonesia's health minister said the coronavirus had not reached his country because of the prayers of citizens. It wasn't until March 2nd that Indonesia announced its first COVID-19 infection. The WHO has urged the Indonesian government to scale up its emergency response measures, including declaring a national emergency. On March 14th, the spokesman for Indonesia's COVID-19 task force said, "We are now treating this as an unnatural national disaster." But activists in the country worry about the millions of Indonesians living in poverty who would be the worst affected. Not only do the poor lack access to healthcare, clean water, and nutritious food, but activists say many of them will continue to work even if they are sick, just to make ends meet. All those factors could increase the chances of COVID-19 transmission.
Given the scale and the speed at which the virus is spreading, it is now clear that no country is immune from the disease or will be spared its severe impact.
The coronavirus has been confirmed in more than 25 African countries. Several nations have closed their borders, cancelled flights, and imposed strict entry and quarantine requirements. Public health experts say Africa is especially vulnerable because many countries don't have adequate healthcare systems and don't have the money to improve them because of sharp cuts in US aid. These countries are already struggling with epidemics of measles, hepatitis, malaria, and HIV.
On est effectivement limité parce qu'après on ne peut pas aller à plus de 3 malades. On ne peut pas aller à plus de 3 malades. Donc il faut qu'on ait un centre qui ait une grande capacité.
Health experts say although many African nations identified gaps in their public health systems during the Ebola epidemic from 2014 to 2016, few have done enough to prepare for a threat like COVID-19. Like Africa, many Latin American countries are already facing other epidemics including measles and dengue. Venezuela seems particularly unprepared for the coronavirus outbreak as years of political turmoil have left its economy in ruins, and many doctors and nurses have left the country. The country's president has ordered all schools and universities closed and urged businesses to do the same. Even the opposition party has cancelled street protests. There are also concerns that deep-rooted social inequalities in other Latin American countries and an overall lack of investment in public healthcare put them at risk during this pandemic. More and more countries are confirming COVID-19 infections, but healthcare professionals say that those numbers are often limited by the scope of testing. Whether it be a lack of funding or public awareness, there are potentially many more infected people who haven't been diagnosed. And those are the people who may be unknowingly spreading COVID-19 and widening this pandemic.